Chediak Higashi syndrome. In this video, we will learn about Chediak Higashi syndrome, a rare genetic disorder caused by a mutation in the lysosomal trafficking regulator gene, also known as the LYST gene. This gene is crucial because it helps regulate the movement of lysosomes within cells through microtubules. When this gene is defective, it disrupts the normal trafficking and functioning of lysosomes, leading to widespread cellular abnormalities. This results in issues with immune responses, pigmentation, and neurological function. Let's start with the pathophysiology of this condition. The primary defect lies in the synthesis and maintenance of storage granules. These granules, which are normally well organized in cells, begin to accumulate and fuse, forming abnormally large or giant granules in certain cell types. For example, in neutrophils, the azurophilic granules build up. In platelets, dense granules are affected, causing bleeding issues. And in melanocytes, there is an accumulation of melanin granules, leading to partial albinism. Additionally, there is a dysfunction in microtubules, the structures responsible for moving lysosomes and other granules within cells. This results in two major problems. First, neutrophils and macrophages cannot efficiently move to sites of infection, a process known as chemotaxis. Second, even if these immune cells reach the infection site, they fail to destroy pathogens properly because their lysosomes cannot fuse with phagosomes to form functional phagolysosomes. This leads to an inability to kill microbes, increasing the patient's susceptibility to infections. Now let's move on to the clinical features. Patients with Chediak Higashi syndrome often present with recurrent infections caused by bacteria such as Staphylococcus aureus and Streptococcus pyogenes. These infections tend to be severe because the immune system is significantly compromised. Affected individuals also exhibit partial albinism, which is due to the defective transport of melanin granules within melanocytes. Another critical feature is neurological symptoms, including progressive neurodegeneration and peripheral neuropathy. These patients also experience bleeding disorders, as the platelets lack proper dense granules needed for normal clotting. One of the most serious complications of this syndrome is the accelerated phase, which can be triggered by infections like the Epstein-Barr virus. This phase is characterized by a severe, life-threatening condition called hemophagocytic lymphohistiocytosis, or HLH. In this phase, there is massive infiltration of lymphocytes and histiocytes into multiple organs, leading to significant damage and, without treatment, death. For diagnosis, a peripheral blood smear is key. It shows characteristic giant granules within neutrophils, platelets, and other cells. Laboratory tests may reveal pancytopenia, particularly affecting neutrophils, and mild abnormalities in blood clotting. Finally, let's discuss treatment. The most effective treatment is a bone marrow transplant, which can correct the underlying immune defect. Supportive care includes managing infections with appropriate antibiotics and monitoring closely for signs of HLH, especially during the accelerated phase.